A very good afternoon, everyone, and welcome to day 3 of Tech Innovation 2021. My name is Alvin Un, and I'm honored to be your host this afternoon. The next program will be our first thematic session for the day on non-invasive diagnostics in healthcare, such as the use of miniaturization and AI capabilities to expand the functionalities of wearables and health tech sensors for different health applications. Should you have any questions during the presentation, please type them in the Q&A feature on your screen. Your questions will be addressed during the panel discussion. First, we have Kao Ping from Wellbeing Digital, who will share about using hearables for vital signs monitoring. Kao Ping?
Good afternoon, everybody. So, with wearable being a growing trend in everywhere, I like for today's presentation, I'd like to share with you what are the other opportunities in this sector. Given that like for instance, HPB has already been giving out wristbands for the last 5 or 8 years. So I'd like to give the audience an idea where else can we explore for opportunities to do R&D and to do market development, for instance. So first of all, perhaps the audience are not familiar, but the list of products here on this screen demonstrates earphones that you can use for listening, making call, listening to music, etc. At the same time, all these devices on this screen actually allows to detect vital signs such as heart rate. Heart rate, the same vital signs that you would detect on a Apple Watch or Fitbit. In that instance, some of these products here actually also detects additional biosignals such as body temperature, interbeat interval, so as to process information such like your heart rate recovery or your stress. So what this means is that consumers can actually use the same PPG type technology in the that is used in Apple Watch, but move them using our technology into the earphone, and people can exercise or go about daily lives while getting their vital signs measured. So talking about the same technology, PPG examples that has been in the watches, why did we choose the ear? The bottom left-hand corner is a product from Philips that actually uses our technology. One of the common myths that we hear from people is that, well, with the watch you can wear it 24/7. With the earphone you cannot put on the earphone 24/7. Now, notwithstanding that situation, the reason why we chose the ear is because I think we can see today that many people would always carry a pair of earphones with them everywhere. I think the trend of people, while there have been a lot of people wearing electronics watches or Apple watches, there are also increasingly a lot of people not wearing watches or wearing mechanical dress watches, for instance, that doesn't do any sensing. So this is a kind of a trade-off between trying to force people to put on something on their wrist that they are not comfortable with versus choosing a location or product, in this case, an earphone, that they bring around with them anyway. And, along the course of the day, as long as they put it on for whether it's a 3 minutes or 30 minutes bus ride, there are opportunities for us to sense vital signs of the user so as to, process information for their health or for their fitness. Perhaps again, unbeknown to a lot of the users, is that if we look at the industry leader, Apple actually ships almost 3 times more earphones than Apple watches. So Apple shipped like 110 million AirPods versus 43 million Apple watches. So this tells us that the market for a hearable is actually much, much bigger than a wearable. These are additional reasons why we choose hearable. And again, into the context of what might be applicable to you is that, again, the audience who are trying to develop sports and fitness or vital signs monitoring device may want to consider the fact that with hearables, the additional advantage is that you can give instructions to the user. One of the market insight complaint that we hear from users often is that, okay, after you detected this person's heart rate or SpO2, then what next? I think on a small wristband or watch screen, there's limited screen size to write out all the instructions. For example, slow down, breathe, or stop, or run faster, for instance. It's very difficult, and especially when we target at the older population. I guess we all know that aging population is a trend in many places besides Singapore. Asking seniors to stare hard at their watch to figure out what to do next is sometimes kind of dangerous, especially if they are walking briskly or even they are jogging. So with the earbud, the additional benefit besides detecting vital signs is kind of like an intervention. What you can use it to tell the user what to do, and that opens up a whole new category of applications for people who are developing products in this area. When you bundle that with apps and AI, there's a lot of things that you can tell the user. For instance, in the case of detection of snoring, again, the microphone on the earphone is very near to your mouth. When someone is snoring, you can actually pick that up real fast. And then when that happens, either or you detect that this person is stop breathing, maybe some intervention in the case of a sound, a loud beep that you can play in the earbud that can wake the person up. Okay, so again, these represents opportunities for health monitoring devices that hearables can offer that wearables cannot. So what have we done in the past? So the top row is just some promotion on our side. We have this optical fusion multiple sensor array technology that we can extract very accurate PPG signal that uses light. PPG as opposed to ECG. The other intellectual property of our company is that we provide a very accurate algorithm. Through the combination of this multi-sensor array and an accurate algorithm, we have actually detected very accurate information that can allow for applications such as power walking or detecting heart rate variability for mindfulness, detecting early COVID symptoms like fever, fatigue, or shortness of breath, for instance. So we have been working with customers, in this case, a particular customer is called Hearalito, on commercializing some of these products out there. So these are just some examples. Another product that perhaps can stimulate your imagination is that I think specifically in case of Singapore, we are having a unfortunately increasing number of COVID cases, and the government has stipulated that for those people who have less or mild or no symptoms, to recuperate at home. Now, for those people who have very acute symptoms, they go to the ICU and they get hooked up to a vital signs monitor. Those monitor that you see on TV that goes beep, 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 hopefully continue beep, because if it goes a down tone, that means the person is gone. Devices like that is called vital signs monitor. It monitors the vital signs shown on this slide. But in the case of home recuperation, a expensive diagnostic device that they use in hospital is needed, but not necessarily affordable. And at the same time, it may not be so easy to be applied because of too many contact points that the user have to fumble with. And so with our hearable, we can actually measure things like heart rate, respiration rate, SpO2, and body temperature. So this is another proof of concept that we are working with one of our customers to develop a three-piece solution: a blood pressure monitor, an earphone that detects the other 4 vital signs, and a screen, or could be your phone, that then combines all these vital signs into a visual display for the user to be able to see their health situation. And of course, in this kind of with aging population, another application that is possible is that in future, instead of just detecting blood pressure, we are going to be able to add more vital signs. I think with COVID especially, people are getting more aware of the other vital signs such as blood oxygen, such as respiratory rate. And therefore, we feel that a device like this that you can park at home could be very useful. So again, this is another example of how we can use hearable instead of wearable, noting very specifically that temperature you detect on your wrist is not body temperature, that's skin temperature. Temperature you detect in your ear is body temperature. So there's a difference between body temperature and skin temperature per se, especially not to mention that for some people, when they're having fever, their limbs go cold. So it'll be very counterproductive if you're measuring on the wrist something that this person has no fever, but actually he's burning pretty badly. Other collaboration opportunities, through observation, we found that this is the vital signs monitor being used in hospital that I mentioned. On the right-hand side, there's this photograph that shows a particular socket that's not plugged in. In that case, it's actually a temperature input that apparently is not used very frequently in the vital signs monitor, even in hospital. Nurses would rather just go around, taking a temperature manually because apparently the existing solution connects to a forehead probe that when you have it in the air-conditioned room, it becomes very inaccurate. So again, this is another thing that listeners, the audience, you might want to explore, developing something unique but targeted at very essential services, and making use of Singapore's advantage in the medical, or our credibility in the medical segment to develop a product for this kind of need. Yeah, this is the sleep apnea home kit that I mentioned about earlier, where unlike the wrist, with this device, you can actually measure the number one symptom of someone who's having sleep disorder, which is snoring. Okay. This probably come to the last page of my presentation. To round out my message today for the audience is that with wearable, it's becoming a red ocean. With hearable, perhaps it's a blue ocean that listeners can consider when you're developing your solution for the health tech or even med tech market. Today, in this particular page on the middle concentric circle, are biosignals that we have already commercialized, shown in green, or the ones shown in orange are the ones that we are doing clinical trials. The ones shown in red, or maybe it might appear as purple, are the ones that are in R&D stage that we are working on right now. So there's an abundance of opportunities in the area of hearables that we like to offer to the listeners. So we are a Hong Kong company with more than 80 patents worldwide. We also have a Singapore branch, and a couple of our colleagues are in Singapore. So we hopefully can invite interested listeners to come reach out to us and find opportunities to collaborate. Parties including you might want to do a product, or maybe you are interested to do some kind of a trial with us. Okay. So in the end, thank you very much for your time. Hopefully I've not overrun my time here. Thank you.
Thank you, Kao Ping. We hear you loud and clear. Next, we have Dr. Philip Wong from Web Biotechnology. We'll discuss a novel transmitting wearable that can transmit ECG data globally between healthcare providers and patients from any remote location in this next presentation. Philip?
Thank you very much for the introduction. My name is Dr. Philip Wong. I am a practicing cardiologist as well as the CEO and founder of WAG Biotech, which is a company that is based in Singapore. Today's brief description is that of our system called the Spider ECG system. It's fundamentally a wireless diagnostic ECG rhythm and RPM, or remote patient monitoring system. The use of the Spider ECG is to detect cardiac arrhythmias. So this cardiac arrhythmias are actually quite common. In the US, for example, 1 in 18 people have a cardiac arrhythmia of some sort. One very common cardiac arrhythmia which we face worldwide is that of atrial fibrillation, and this affects about 2.3 million people in the United States alone. This AF or atrial fib is associated with an increased risk of stroke and therefore mortality. In Singapore, it is estimated that 1 in 15 above the age of 65 have AF, and this rises to be about 10% or 1 in 10 above that of age of 80. With a population of about 5.7 million people in Singapore, we experience about 7,000 strokes per year, of which up to a third of them are thought to be due to underlying atrial fibrillation. Now, just to mention about cardiac rhythm is also considered a vital sign, but is a bit different from that of heart rate. Cardiac rhythm is derived from your ECG or EKG or electrocardiogram. And it's a very important vital parameter because of the fact that your heart beats about 80,000 times a day. And if you were to just skip a beat, for example, for 3 seconds, that can mean your heart will stop and blood may not flow to your brain, and you may actually experience a blackout. So it's important for us to have continuous monitoring of the cardiac rhythm to have any significant diagnostic capabilities. So of course, the COVID has really impacted, monitoring, especially from the hospitals, because of the barriers that arise that prevent patients from visiting hospitals. Now, because of that, physicians are really very hard tasked to make very good clinical decisions because we are missing data such as cardiac rhythm if they don't come to the hospital to put on sensors and so on. Wireless remote transmission of data will allow this continuous data acquisition to occur without the worry of contact. So this new monitoring landscape, I feel, will consist of a lot of non-contact data acquisition for cardiac care, and this will be the new normal post-COVID. Now, systems such as Spider ECG do provide very high fidelity, continuous data connectivity to patients outside the traditional hospital setting. What is the core technology of the Spider? It's fundamentally a wearable sensor that provides a continuous data transmission to a back-end database. So the entire system is basically a platform. It's very unique because it utilizes current available wireless mobile solutions. It is the world's first continuous transmission system with direct patient to database capabilities. And this, of course, allows real-time ambulatory remote ECG monitoring across very large geographical distances, and also allows, because of the cloud database, accessibility or full disclosure to physicians anytime, anywhere in the world. The Spider is also self-manageable. It has no wires and can be, of course, deployed contact-free, delivered to a household without the need for the patient to visit the hospital. It is fundamentally what we call a zero footprint system and does not require any significant infrastructure to the hospital to use or utilize this system beyond the traditional hospital scenario. This is a picture of a standard diagnostic ECG continuous rhythm monitor called a Holter ECG that is utilized in the hospital. These systems are very widely used in current hospital setting. Perhaps 90% of patients undergoing rhythm analysis will put on one of these to test for any rhythm abnormalities. Now, these systems are also plagued by the fact that they are recorders, they do not transmit, and patients have to carry the recorder or collect the recorder first from the hospital and then bring them back and have the data downloaded for analysis to take place. So the Spider is very uniquely different. It's very easy to use. You see the picture on your right side of the screen. It can be managed by an individual very easily. It's paired to a phone. The phone gives you a visual display of the ECG rhythm and also allows an interactive menu that you can send in events or symptoms if you feel them. This helps you to correlate any ECG abnormalities with the symptoms. And of course, the phone then transmits the data to the cloud. So the platform actually consists of 3 proprietary components, as I mentioned: the wearable itself, which is self-administered. We have a smartphone app that enables a phone to change itself into a full ECG display, as well as the interactive menu that allows transmission of events or symptoms. And lastly, we have the backend cloud server, which we call Dr. Spider. It's basically a data storage platform, but also a web-based physician dashboard that we can view incoming ECG after it is analyzed by algorithm. So this entire 3 components, we put it together and call it a vertical silo. So on the schematic on the right, you can see a patient who wears this device, sends the data to the phone, and the phone goes into the cloud server. So this system is actually a class 2 medical device classification, and is currently CE marked, as well as in Singapore HSA approved until since 2014. The product is also registered for use in Malaysia, Thailand, Indonesia, Philippines, Vietnam, and Taiwan as well. Now for Dr. Spider, what we actually do is a system of federated servers. So we have a system of servers that control, of course, the point of entry, but are segregated in terms of what the different servers are used for. For example, we have a anonymization server, so that data that comes in, and if the data needs to be reported by another third party, the third party is unaware of the name of the patient, and so can report the data blindly. So this protects individuals, patients from exposing their identity, even if the system is, hacked and so on. We can also flexibly arrange the databases, and it can be ring-fenced and isolated from one another. For example, if a hospital were to use 30 devices, there's no possibility of mixture of these data with another hospital who has, for example, 60 devices and so on. So the databases can themselves be ring-fenced. And of course, it can be customized for different users, hospitals at different geographical locations. Now, one of the server also houses an algorithm. This algorithm is medically regulated. And of course, the algorithm provides scrubbing and analysis of the data. But in future, AI programs can also be incorporated into this system that can analyze data that is streaming live from a patient and so on. So a lot of possibilities for such a system in the future. Now, in terms of data flow, the data flow you can imagine, so this nurse who is utilizing the system is actually seeing her own ECG on the smartphone. This data is then stored in the phone and being transmitted continuously to our cloud database, so that if a physician goes in and look at the database, and this is the dashboard that is presented to him, he can see strips of rhythm that are coming in live from the patient. So you can imagine if the patient is in the US and you are in Singapore, and I'm looking at my dashboard here, I can actually see the ECG of that patient streaming in live 1 or 2 seconds later. So this is a very liquid system. And in this case, we call it a liquid ECG system because it is very fluid and can be flowing about anywhere in the world. So one thing that is very interesting is because we use the mobile phone to transmit the data. So as you know, the mobile phone automatically puts its own time zone wherever you are. So in fact, even though the system is operating in different time zones, these are all rationalized in the cloud server, because the phone is the one that stamps the time onto the data that is received in the cloud database. And the system is very scalable. So as we increase the number of patients in the database, it's very easy to increase the capacity of the database, or we can actually mirror the servers into other geographical location as well. Now, in terms of the clinical application, this is very, very important because I think as a medical device, if you don't get the medical clinical applications and implications correct, it then has difficulty in commercializing the product. In this case, we are currently using it mainly as an extended diagnostic Holter device. So this device can be given to patients for diagnostic purposes, for diagnosis of cardiac arrhythmias, and we can actually serve the patient in different ways. So for example, we have an academic package where because of the flexibility of the system, the hospital itself and its medical technologists can go into the database and report the data directly. Or we can also have a service package where we have an ECG core lab in our company that reports the data for clinics and of course sends the report directly to them. So this is a diagnostic component of the platform, but it also, because of its usability, can be used for high-risk home monitoring solutions, which we are also using now. So for example, if a patient has a major cardiac surgery or has a major procedure,
committee meeting.
This will of course impact the patient if he stays at home and is not monitored, and these devices can be sent to them. Likewise with rehab or physiotherapy. So many patients are now, because of COVID, undergoing rehab at home. A monitor can be put on them to monitor their cardiac rhythm as they continue with their rehab at home. Lastly, it's because we control everything from the cloud, a very simple switch of the mobile app from the cloud can convert a continuous spider monitor into an event monitor. Now, this is, of course, what we consider a OTC or B2C monitor. And of course, patients can purchase this and they can send data to us, and we can also report events rather than a continuous strip of ECG. So because of this, the system actually can impact every part of a patient's journey, from pre-hospitalization to post-hospitalization, and even in care of the patient after in the long term. So the innovations for Spider, I think from a clinical point of view, it bridges a very important gap between hospital-based diagnostic Holter monitoring, as well as remote patient monitoring or home monitoring. The system is a fully digital system and it can be used globally. It has a zero footprint and no brick and mortar infrastructure is required for setup. So for hospitals that want this system, they can set up the system very, very quickly. It can be administered counterless or counter-free outside any healthcare facilities. For example, now in COVID, we are delivering many of the medications to patients so that they don't come to hospital to collect. This device can be sent out to them in the same way. The backend system or Dr. Spider is a very flexible and customizable backend. It can be designed so that it protects patients' data, as well as we can also control the accessibility to the physicians or management care team that is looking after the patient as well. As mentioned, highly scalable. It massively simplifies rhythm data analytics because all data is centered and organized in the cloud. And it has a full engagement model, meaning that the physician is able to fully see every beat of the ECG rhythm. The system by itself is very robust. We have more than 18,000 patients with a mean duration of 3 days. Or average of 200,000 heartbeats per session in our database now. We have a very large installed database, as well as installed base in the public as well as private hospitals in Singapore. We have conducted trials, one in sleep apnea and one in atrial fibrillation. And as mentioned, the product is registered in many countries in ASEAN and also in the EU. This is my last slide. Lastly, wireless ECG diagnostic and remote patient monitoring, or RPM, provide tangible benefits to patients and healthcare workers or hospitals in terms of being less waiting time, faster turnaround time for diagnosis for patients, better clinical decisions, and of course, less frontline manpower requirements for cardiac rhythm care. The continued data acquisition and connectivity is very important for any remote patient monitoring needs. It is usable during the lockdown environment with mobile home delivery. And of course, it's a fully digital system that expands cardiac rhythm monitoring and management to beyond the very traditional hospital setting. Thank you for your attention, and maybe we can take some questions later.
Thank you, Philip. Following Dr. Philip Wong's insightful presentation, Dave Hurhangi from Wear Health will elaborate on a more holistic approach to continuous health monitoring. Over to you, Dave.
Good afternoon, everybody. My name is Dave Hurhangi. I'm the CEO and CTO of Wear Health, and we design and manufacture wearable vital signs monitors. I'd like to talk a little bit about our journey, which I think is important. A journey generally shapes a company's ethos and their fundamental concepts that are at the heart of its products. And these building blocks are what set us apart from our competitors. These individual attributes come together and deliver more than any single facet, but it allows us to build sensors that our customers trust and rely on. Our journey begins in about 1985 when I developed my first wearable monitor, and it was the radiation dose monitoring system for nuclear submarines. The device was about the size of a packet of playing cards and worn in the top shirt of the sailor. But the problems and issues we addressed in 1985 are still the problems we address today with wearables. So the first one is accuracy. If you can't get the accuracy right, there's no point in doing much else. Usability, will it work where I need it to work? And do people need to be trained to use it, or can they just put it on and it will just work? Durability, also very important. If you break 4 or 5 sensors in the mid-Atlantic on a nuclear submarine, DHL won't be delivering new ones. So your solution has to be robust. It has to work everywhere. No ifs, no buts, no excuses. It just has to work. So these 3 concepts are also at the heart of all wear products that we manufacture today. So back to today, and this is the current scenario. It's the image that many people have of how patients with chronic conditions or those who've just been recently discharged from hospitals are monitored at home through their recovery. Unfortunately, as we probably know, this is more of the reality. And this elderly care demographic are the largest user group of healthcare services. So expecting an 80-year-old with possibly a chronic condition such as arthritis to log on to a portal or an app and enter the data, it just doesn't work. And as our populations globally age, this is just going to increase. And the reason for that is mainly these devices were never designed to be used by consumers. This fingertip SpO2 monitor is designed for a trained clinician to use, not a 70-year-old with possibly even poor eyesight. Again, we are issuing these to consumers now and expecting them to be able to use them, and it's just not realistic for the most part. So today, on average, in a general ward in hospital, you'll be monitored about once every 8 hours. It's down to labor, it's down to cost, it's down to staff availability. And every day, patients die in some of the world's most modern hospitals because they're not monitored. We've also learned that using disparate devices like Bluetooth and stuff is clumsy. It's just not designed for use by the elderly. And for many users, a nurse or a carer needs to visit the patient at home. And this makes the process just too expensive and dependent on labor availability. These numbers are for NHS England, not Scotland, and they exclude Scotland and Wales. So they're similar globally as well. 53% is the increase in emergency admissions from patients aged over 65. And 65% is the proportion of elderly bed days that are occupied by patients aged over 65. And NHS England spent £13.7 billion just for readmissions of patients the second and the third time round. So as you can see, in the UK, we currently readmit 14% of all discharges. In many countries around the world, it's worse. For the US, it's about 20%. And despite medical advances, this graph has just been heading the wrong way for the last 10 years. And you can clearly see it's not going to stop. Globally, this is just unrealistic. It's unsustainable, whether that's socially, financially, or logistically. So what we need is a machine that can spot this deterioration in a range of scenarios. It has to be autonomous. It has to be usable by an 8-year-old with no digital skills. And the usability has to be for both the healthcare provider and the patient. So it has to be a machine. We simply just don't have enough people to do this as populations age. And at this point in our journey, the EU also recognized that this is a large cost and poor patient outcomes are resulting from emergency readmissions. So the EU appoint these 5 university hospitals here as a sort of think tank and say, please, can you come up with a solution? So they go out to the market, look at the devices that are out there, and conclude that what we need just doesn't exist. So they put out a tender to the whole of Europe. Please build the ultimate vital signs monitor that we can use not only in hospitals, that we can send patients home with, and it will monitor them there 24/7. And this is a Sentinel device. We won Nightingale in phase 1 and 2, but the real prize was actually working with the 5 university hospitals for 2 years. A lot of medtech is not actually developed in conjunction with the customer. It's kind of medtech companies, the large guys, they sort of come up with a device and say to the market, here you go, use this. There's very little consultation that happens. But this was completely different on the project. The devices are autonomous. They work whether they're connected or not. The AI is local. If it has no connection, it still carries on working. Sentinel also does a cuffless blood pressure estimation, single lead ECG, and a range of other measurements, which I'm not going to go through at the moment. It's worn on the upper arm, state of the art, and as I say, single lead ECG continuously without having to touch the bezel like you do in the Apple Watch. Essentially, we took the conventional bedside monitor and we converted it into a wearable device that's comfortable, that patients sleep with easily, that's been through usability testing, and is well accepted by the patient and the clinician for ease of use. And then the journey kind of continues. COVID arrives in February 2020, and the people we're working with at the time say, can you take that Sentinel device and reduce it so we can have a very low cost device for COVID? And so we developed C-Detect, and through the advances in semiconductors, we reduced the size, weight, and the power consumption of the device. So this will now last for 10 days on a single battery charge. And I'd also like to point out one thing at this point in time. Both C-Detect and Sentinel are medical devices. This is very different from a sports watch and activity trackers. A sports watch will always give you an answer, even if it's just a guess. It is because what people expect of a sports watch is if they don't get an answer, they think it's not working. The difference between a sports device and a medical device is that if a medical device doesn't know the answer, it won't give you one because a medical decision is made on those numbers. So what are sensors with a different form factor capable of? Turns out quite a lot. And as I say, we don't have time to go through all of them. But what Wear do, which is slightly different from most other companies, is we give all of this data to our customers. We hope that they generate their own IP. They excel in their fields, whether it's preeclampsia or heart disease or whatever, and we let them use the data to generate IP in their own speciality. As an example, we store all the data, including accelerometer data, at 25 hertz. And we partnered with University of California for epilepsy diagnosis with their algorithms that find telltale patterns of epilepsy in that mass of accelerometer data. So none of this data ever passes through our servers. The customer sets the endpoint and they own all the data. So usability also means looking at the healthcare provider's part. So where sensors can be pre-configured and sent to the post, they can be dispensed by pharmacists or even given to you by your doctor. There's no user identifiable data held on the sensor, and it never loses data, even if there's no connectivity. And while the device may be small, it's still capable of a great deal. So one of those original questions was, will it work anywhere? Yeah, we've put Bluetooth 5 in here. It will connect to LoRaWAN. There's a full cellular modem in there, NFC and Wi-Fi inside. No infrastructure, no routers, no hubs. Nobody has to install anything or go to the patient's home. Patients can be moved in hospitals, wherever they need to be. And it can be configured with an NFC card, just tap and touch, and that's it on the Wi-Fi. Or you can set a cellular endpoint. And as I say, if there's no connection, it stores the data until it has an opportunity to transmit by any one of those communication channels. So prevention is always better than cure, and we believe in a more holistic approach. From sensing not only the patient's vital signs, but also taking into account their physical environment and the patient's physical activity, we can do so much more. So we use Bluetooth beacons, indoor Bluetooth beacons, and they report location, temperature, humidity. And that allows us to answer questions like, why is the 8-year-old with pneumonia not getting better? Because she's sleeping in a cold, damp room. Or perhaps an increase in toilet visits, possibly indicating a urinary infection. We can use AI to predict. And the detection of near-miss falls in the hall perhaps means we should fit a handrail or light the area better. So cheap beacons allow us to surface so much more information. And that includes mental health insights. We believe in a more holistic approach. Are they sleeping well or just falling asleep on the couch? Are they going out? Are the activity levels falling? So perhaps we can identify depression. All of this becomes possible with some cheap $3 beacons that you can put anywhere in a home and label them up as the different rooms and locations. Again, goal motivation is possible. The sensor records data such as step count, calories expended. How sedentary are the patient? Are they just sitting in a chair watching TV for 8 hours a day? Can we motivate the patient to take a more active part in the recovery? Again, no recovery, no configuration, no switches, no dials. All the patient has to do is wear it. So the use cases for C-Detect, as seen here in this slide, it has many more uses than just a device for COVID. We integrate with existing platforms, we don't compete. Most platform providers already have a trusted relationship with their customers, and they work in a way that the customer is happy with. So we're integrate with that platform to provide and automate the labor-intensive process of manually recording vital signs. And we do this in hospitals and in patients' homes. So if any of the topics I've spoken about today are of interest to you, please get in touch, or we can speak later at the Q&A. Thank you for listening.
Thank you, Dave. Now be sure to submit your questions in the Q&A feature on your screen. The next segment will be a panel discussion moderated by Dr. Yeo Joo Chuan, Translational Manager of the Health Tech Translation Hub, also known as HATCH, iHealth Tech, National University of Singapore. We'd like to invite all our speakers back on screen as well. Over to you, Joo Chuan.
Thank you, Alvin. And a big thank you to the speakers for the fantastic talks. I think it's really exciting to hear the latest innovations from the technology frontrunners in the space of non-invasive health diagnostics. Now, I know we are running very short on time. I have asked for permission to extend the time a little bit to 2:10 because we started off a bit late just now. So for this panel discussion, I'm going to try to do a round robin type of questions and ask perhaps a broader category on technology and another broader category on the business. So we go straight into the technology point. I noticed all the speakers chose a very unique part of the body as a target placement, with Gao Ping in the ear, and Dr. Philip Wong's spider ECG on the chest, and Dave's Sentinel device on the arm. So maybe I will direct the questions to each of the speakers on what are the challenges of each of the diagnostics on the different parts of the body. So starting with Gao Ping, I think one of the audience here make a very excellent observation here that is there a possibility of bring hearables and hearing aids together into a combined platform, and what are the challenges in doing that? Gao Ping.
Well, yeah, certainly yes. As a matter of fact, we are already working on prototypes for a particular worldwide top 5 hearing aid companies. I think these days with earphone being used by very young children to 80-year-old, akong ama, I think all these are in some form, some kind of earbuds. Because of the size of the earbud being very small, the challenges, of course, is in terms from a technical perspective, is of course in terms of power management, sensitivity. Well, lucky for us, in the ear, besides the advantage that I talked about earlier, the ear constitute a very good location because of a lesser amount of ligaments, muscles, veins in the ear versus the wrist. So the signal tends to be a bit more cleaner. You cannot move your head 360 degrees the way you move your wrist. So there could be less noise, motion artifact. So I think the challenges is basically with a small size, how do you put all the sensor together? But on a market perspective, I think it's very good because a lot of people are putting things in their ear.
Excellent. Thank you, Gao Ping. So the next question is to Dr. Philip Wong. I noticed the Spider ECG is really small compared to the traditional 12-lead ECG. So does the Spider ECG take less measurements, or is there a reduced accuracy in that?
No, actually, firstly, I think position of where the sensor is first. I think the best, obviously the best place to receive the heart signal is directly above the heart. So that's why the Spider ECG as a wearable is placed over the location of the heart. Now, one of the difficulties, of course, is that the resolution of the ECG becomes a problem if we separate the positive and negative sensors by too short a distance. So we have sort of got the measurement right. The distance between the positive and negative is about 4 centimeters, and that is probably the closest distance we can have. Now, the device alone, it's obviously can be miniaturized a lot more. I think what we have is a very easy to produce device. It's can be mass produced very, very quickly. It's powered by alkaline batteries because that is what is widely available. And we don't use rechargeable batteries because you can imagine when you need to recharge the battery, you have to take it off. So some companies that have rechargeable battery sensors, they basically have to supply 2 sensors to the patients to get a continuous data set. In the future, I think there will be, of course, downsizing of the thing, but one thing to be concerned about, if it's too small, elderly patients tend to lose it, and there are patients who drop the sensor, in water and other places that are not. So if we miniaturize it too much as well, then there is a difficulty for elderly patients to use it.
Thank you for the answer, Dr. Philip Wong. Next, we go to Dave. Good morning, Dave. Thank you for joining us today all the way from UK. Can you comment more on the challenges of having a wearable on the arm? And can you comment also on the predictive capability of this continuous monitoring wearables for predicting fall detection or any other applications?
Yeah, certainly. I mean, I think all of the speakers here today know that motion for any form of measurement is our enemy. We're on PPG technology, we're measuring light at the nanometer scale. It's 10 to the minus 9. So this is probably the worst place you could possibly put a device for measuring. All of us are looking for stability. And the upper arm gives us some degree of stability over watches. And I think I commented on one of the slides where you saw sports devices will give you an answer, even if they have no idea whether it's right or wrong. People just expect to see a number there. So we chose the arm mainly for the reason of stability and lack of motion artifacts corrupting the data. but also because it's also slightly out of your vision. You don't see it. So because you don't see it, you tend not to remember you're wearing it. And in our usability studies, we found that if you have some patients, they see something on the wrist and they'll just play with it. I don't know, they fidget with it, but if you can't see it, you tend not to do it. And it's the same with many of these devices here today. So there are the other thing we get. I think you asked a question about fall detection. We have a 3-axis position sensor inside our device. So it means we know you're upright, you're face down, whichever way you are, we can tell. And one of the issues with falls and false alarms is they can't tell which orientation you are. So you may just have a near miss, but you're still upright. You haven't fallen. And many of these wrist-based devices will just set an alarm off when they've stumbled a little bit. We record that as a near miss, and it's like, perhaps we should give you some, walking aids or put a handle somewhere. So yeah, the arm was chosen for some very, very good reasons, and yeah.
Excellent. Thank you, Dave. I think here data is really king here when we are able to bring different data from our body and use this as a predictions for our health diagnostics. So I'm going to go into the next questions, which is more on the user perspective or more on the business oriented perspective. We all know that the health industry is a very peculiar industry because the user is not the decision maker and the decision maker is not the buyer. Maybe each of the speakers can share with the audience how does your business model work and how do you pivot around such conundrum. Maybe we start with Gao Ping. Does your hearables need to be prescribed by a clinician? Or is it possible for you to aim it to be available off the shelf?
Okay, so we started off targeting the ear. When we first started off, probably 8 years ago, it's very rare to see someone with something sticking out of their ear without you thinking that, oh, poor guy, this person cannot hear well. Since then, especially since Apple launched the AirPod, it become very, very common and fashionable to have something coming out of the ear. We want to latch on this trend. We want to add sensors without adding functions because we want to target preventive healthcare. I guess the difference between what we are doing and what the other speakers are doing is that we are not targeting at people who know that they have a cardiac or AF problem in that sense so much as to go out to purchase something. We are targeting at people who are just buying a pair of earphones, listening to music, and it comes with additional function of sensing, so that when I go exercise, I want to sense because I've heard about I shouldn't my heart rate shouldn't go that high, and so this person may be wearing this earphone, listening and monitoring his heart rate, and over time, by knowing one vital signs and two vital signs, then maybe he will want more and then he will research more. So in this case, the person who buy it is probably also the person who uses it, and at some point, of course, if they might want to have more, for example, AF, then they might go to Philips, for instance, and to those more prescription diagnostic devices. So right now we are more positioned as a monitoring devices.
Thank you, Gao Ping. Dr. Wong, I think Spider ECG is right now the medical grade device for home use. Do you think it can replace the ECG tests used in hospitals and clinics? Do you foresee such a business model around this?
Actually, no. So we are actually what we call a rhythm monitor, which is quite different from a standard 12-lead ECG. But I think coming back to your original question, business-related question, I think for anyone who is going into this kind of business, it's very important to focus on what the clinical application is first, right? So I think that's the first thing. So we are focused actually on extended monitoring of the heart. The traditional monitor, which I showed you the picture, because it's full of wires, and so on. Patient can't put it on him or herself. It can only be utilized for one day. So our initial goal was to extend the monitoring to a longer period. And our monitor has been used in certain patients, those patients who are fainting unexpectedly and so on. for up to 30 days. So I think getting the clinical application right is the first thing. Now, second thing is then you realize that even though you've got a novel sensor, you've got it regulated and everything, there's always a clinical barrier, and that is basically doctors are very stubborn. So doctors very hard to change, what they are used to when they start off with. So we actually spend a lot of time, and you can do this by various ways, by conducting trials and so on with them, to show them that this device actually is much better than what they are used to. So second thing is, before you even think about your business model, is to be very clear what are the applications that is being used for, and secondly, what are the barriers you need to clear. Lastly, I think the model itself will sort itself out after a while, because by then you will know what the physicians want and don't want, what the patients want and don't want, and you can basically design your model to suit them and to, in a sense, ease their pain, right? So doctors are undergoing a lot of pain. So I can imagine, if you ask me to look at, all the data that is coming in from all the wearables, it's so much data. I have no sense of, how to look at it and how to organize it. So what we did, of course, is to put everything on Dr. Spider to be able to produce a very simplified report so that the physician can tell the patient in 3 or 4 points exactly what has happened over a period of 3 or 4 days. So that basically is our fundamental business model now. So when we go out, we tell clinicians, we put the patient on a 7-day monitor, but we produce a report that you can scan through and read in 5 minutes. And therefore that eases all the problems that are being set in your current practice. So I think all these points account towards how you get to stabilize a business model.
Excellent. And it's very interesting for Dr. Wong for you to say that physicians or doctors are the mindset is not willing to accept such changes, because you are a practicing cardiologist as well. So it really shows how entrepreneurial you are and how innovative your work is. Thank you very much, Dr. Wong. Dave, how about you? How is the situation in UK? Do you find that there is a lack of acceptance in such devices, and how do you overcome such challenges?
I think COVID has made a huge change to the acceptance. I would imagine 2 years ago, very few people actually knew what this was. They now know it's a fingertip SpO2. The world knows. And they also realize the issues of, one test for this at 2 o'clock in the afternoon, is that the same as what's going to happen to me at 2 in the morning? We had cases of silent hypoxia where, people would rapidly, their SpO2 levels would decline. So yeah, COVID has changed continuous monitoring, I think, for many people. People get nervous in front of their doctor as their heart rate elevated. I think, Dr. Philip will know more about that than us, but a lot of things have made continuous monitoring much more acceptable. And again, we saw many old people being admitted into hospital, and they kind of realized, we don't have room in the hospitals for all this number of people with COVID. And so monitoring at home became a reality for many countries around the world. And so, yeah, the acceptance has definitely been elevated because of COVID. And we're now looking at, it's keeping people out of hospital emergencies. And can you see the decline early on and intervene before it becomes an emergency?
Yes,
I just
thank
put my
you, Dave.
timer flashing, sorry.
No, I think, yeah, it's excellent. And I think we, even in this pandemic, we have our technology to be thankful for, because we are at the age of technology that we can have technology to help us to go through this pandemic. I know we are really running short of time here. I just want to maybe give 30 seconds for each speaker to let the audience know the future of non-invasive diagnostics. Will it be something that is non-contactless, or will it be something that is implantable? Maybe we can have Gao Ping 30 seconds to present to us the future of non-invasive diagnostics.
I think basically the first time that we found something wrong with our car is when we are driving it. So a lot of time, what I'm trying to say is that with this monitoring, motion is an issue, like what Dave says. So we believe that in the next foreseeable future, non-contact or implantable will probably be a bit far off. Contacted devices that are part of someone's daily life will be very important. And you can use that device, such as an earphone, to do sensing, and it will really help in preventive healthcare.
Thank you. Dr. Wang?
Yeah, actually, my own feeling is that the sensor by itself is not such a critical thing. You know, sensor technology will improve, the sensors will get smaller and so on. What is critical now is actually the organization and the consolidation of data that's coming from the sensor sets. That have to be make sense of before it can be used clinically. So you can have a lot of heart rate coming in, but it doesn't make medical sense. It's practically of no use to the patient. So I look at advancements more in terms of data consolidation, organization, and of course using algorithms or AI to present this to way physicians can understand and then make clinical actionable items from those databases. So I think the cloud, is really a cloud-based type of EMR or EHR that organizes data is the way to go in the future.
Excellent. And Dave, would you comment on that as well?
Yeah, I mean, I think, if you take your car, it monitors itself hundreds of times a second and you never even know it's happening. And I think sensing solutions have to become that level of autonomy where you don't even know it's happening. You don't have any presence of the thing in your mind at all. So I think, yeah, the monitoring has to become much more, even more uninvasive than it is now. And, as Dr. Philip was saying, the data has to make sense at the other end to a doctor. It has to be consolidated into a form that they can understand. Just throwing numbers at people isn't gonna do it. So yeah, AI and less invasive sensors than they are today.
Excellent. Thank you very much, speakers, and I want to thank all the audience. I'm afraid I do not have time to go through all the questions, but it has been a wonderful session. I want to congratulate the speakers again for their work done, and I wish all of you the very best. And thank you very much for these sessions. Over to you, Alvin.
Thank you, Dr. Yu.
Thank you, gentlemen. We have come to the end of this session on non-invasive diagnostics in healthcare. Thank you to Kao Ping, Dr. Philip Wong, Dave Herhengi, and Dr. Yeo Joo Chuan for the insightful discussions. Please click on the info button on your screen to submit a rating out of 5 stars and your feedback before exiting this session or joining the next one. For attendees who will be joining us at our final session on evidence-based traditional herbal medicine, we'll see you shortly at 3 p.m. Singapore time. Thank you once again.